And good morning everyone. Now today we are again moving forward to the discussion of our previous some of the USMLE questions, the clinic VNAC, to understand the basic, to test the basic knowledge of microbiology. And now we have previously discussed about this question number 11. Now we are revising. This is the question present on your Kaplan book. At the end of your book you can find these are all the questions to practice. You can go through it. We are just trying to find out how the basic knowledge, how the microbiological knowledge are tested, and what were the scenario given and which level of question they are. Okay, moving forward, we can see this question number 12. A 33-year-old man present to the emergency department with fever that is 102 degrees Celsius, 102.5 degree Fahrenheit, facial palsy, headache and malaise. So they are talking about any infection that leads to the fever as well as facial palsy. So normally facial palsy are due to viral infection. Also there are some bacterial infection that cause facial palsies, like Lyme disease, which is caused by the Borrelia burgdorferi, and that the organism was transmitted by the vector known as the Exodus tick. Let me move forward. There must be something given to you to identify it is a viral or bacterial. Okay, so fever, that can be facial palsy, that can be present in both bacterial and viral with headache and malaise. But there must be something else. They are talking about the circular maculopapular rash was identified in the patient on the left shoulder. So on the left shoulder they are found there is a maculopapular rash that is circular in nature. And if you remember, if you go to the previously to those Lyme disease in your USMLE Step 1 2021 Microbiology, where you can see this Lyme disease that is caused by this Borrelia burgdorferi bacteria, which was transmitted by this Exodus tick, that actually has a characteristic feature of this bull-like circular rash, and which is only a characteristic feature of your Lyme disease. So this Lyme disease, they are already giving you a hint. A circular maculopapular rash was identified in the patient left shoulder. The patient was unaware of the rash. The patient likely acquired the infection by which of the following route. Now they have lead you to the disease that is Lyme disease. Now you have to remember everything about the Lyme disease. Okay, it is a bacterial infection causing characteristics, this bull rash or say target rash. Then there are the different stages of this Lyme disease, if you remember. So this was the Borrelia burgdorferi, this was the transmitted by Exodus tick. Then it was a natural reservoir in the mouse, and deer are essential to tick life cycle but do not harbor Borrelia. There has the common in northeastern United States, and they have different stages. Like in stage 1 there was a localized erythema migrans, which is known as the Spuli configuration, pathognomonic, and in the second stage there was early disseminator, second lesion, carditis, AV block and facial nerve palsy. So this was second stage. On third stage they are late disseminator, that is encephalopathy, chronic arthritis and peripheral neuropathy. So you understood about, you revise, you go back to the knowledge. This first aid should be by heart, each and every word to you to understand or to deal with the questions. Okay, so you have to get all this information present on your USMLE Step 1 by heart. It should be on tip of your tongue. It should be printed in your mind if you are actually want to score a good mark or good score. So what was the formula? That is the Lyme pie to the face, facial nerve palsy, arthritis, cardiac block and erythema migrans and treatment with doxycycline. Now on the basis of this information, they are not asking you all of this thing. They are asking some of the specific thing, and they are asking the patient likely acquired the infection via which of the following route. So the route of transmission, and we know this is the bacterial disease caused by Borrelia burgdorferi, but was transmitted by a vector. What was the vector? The vector was Exodus, which is a arthropod. So is there Exodus written over there? No. So what is Exodus? Is it the arthropod vector? So the answer is C. So you should understand in this way. Okay. So consumption of contaminated food, no, it will not be transmitted. Direct contact with the fomite, that will also not be the answer. Arthropod vector, yes, Exodus tick is arthropod vector, so that is the answer. Respiratory route is not a transmission of this Borrelia burgdorferi, neither a sexual contact. So this is a vector borne disease, and it will transmitted by arthropod vector. And your answer is, you have reached to the answer. Let's move forward again, and we are on now 13. So what is the Question: a 25-year-old man developed a high fever and swelling in the armpit. So there is a fever as well as there is swelling in your armpit. So in armpit swelling, it means there is a lymphadenopathy. Regional lymphadenopathy is there with fever in the armpit and groin. So there will be the inguinal lymphadenopathy as well. Aspirated from the lymph node reveals gram-negative rods with bipolar staining. And this gram-negative rod with bipolar staining, the patient is most likely a farmer from the southwestern US in the military, living in the dormitory and sexual promises. So from your what you can option also, you can identify what your question is going to ask. They are saying your patient come with the both inguinal as well as this axillary lymphadenopathy with fever, and they have aspirated that lymph node and found a gram-negative bacteria that has bipolar staining. And there are only few bacteria that are bipolar staining, and that is actually Yersinia pestis. Then there is the Bordetella. So there are only few organisms, and among them only those are bacteria that cause regional lymphadenopathy, that is buboes with fever, is Yersinia pestis. So Yersinia pestis is your diagnosis. Yersinia pestis is common in the southwestern part of the US. So from now you have to remember, from the southwestern part of the US, if they are talking about a patient coming from the southwestern US, then in the bacteria you have to think about the Yersinia pestis. Talking about the virus, it will be the hantavirus, and if they are talking about this fungi, then it will be coccidioides. So these three feature: bacteria, Yersinia pestis; virus, hantavirus; fungi, this is the coccidioides. These are the more prevalent in southwestern part of the US, and southwestern part of the US is the answer, because Yersinia pestis is normally common in the United States, and that is southwestern part of US. So hope you have understand how we are dealing with the questions. Now let's move forward, and we are going to the question 14, where we are finding out a previously healthy 5-year-old infant. So we are an infant who is a 5-year-old present with the apparent upper body weakness, including drooping of eyes, head lag, drooling, and inability to sit unassisted. So a baby having the weakness of the muscle, you can see this is the weakness of your upper eyelid muscle, head lag, then drooling, and then inability to sit unassisted. So all the muscles weakness is founding, and this is presenting, giving a hint in an infant, the most likely infectious. Now what is the infectious form? So you need to first identify the disease, then you identify the bacteria, and then you identify the infectious form of that bacteria. So there are the three things you have to do with this question. So you have to understand first the disease. Okay, infant with weakness of the muscle. Okay, this is infantile botulism. So which is caused by the bacteria Clostridium botulinum. So this botulinum infectious form is actually Clostridium species normally are. There are two things. If you're talking about this is the presentation of the toxin mediated disease. So toxin was released by Clostridium botulinum. That was a botulinum toxin which caused this weakness and all the feature of the infantile botulism. But they are asking you what is the most likely infectious form. So they are not asking about what happened or what was the pathogenesis. They are asking you what was the infectious form of that bacteria. And obviously the bacteria was transmitted from the honey to the baby in the form of endospore. So what is the answer? Elementary body, that is related to this chlamydia. We are not talking about this. Endospore, yes, endospore is the answer of this, because endospore is the form of transmission of this botulinum toxin. Then exotoxin, although exotoxin, this botulinum toxin is exotoxin that act and has this all the symptoms or say pathogenesis has take place, but they are not asking about the pathogenesis, they are asking about the infectious form. So endospore is your answer, exotoxin will not. Reticulate body is again affiliated to the chlamydia, and vegetative cell is also not a person, because vegetative, when they get endospore is in the honey, after ingestion of the honey, when it enters inside your body, then it will convert into the vegetative cell. So the infectious form is endospore of the Clostridium botulinum, and that is your answer. Okay, let's move again forward. We'll do another question, and that is a 16 resident in a retirement home have fever, malaise, and anorexia. These residents have taken their meals prepared by the same kitchen. Blood culture cows 11 of this resident grows Salmonella enterica subspecies typhi. The primary reservoir of this organism is. So they are asking you, this is a pretty much direct question. They are saying there is a group of people living in a resident in a retirement home. They have the fever, this malaise, anorexia. This has taken the meal from the same kitchen. So they are saying about you, a source is the kitchen. They have developed the similar symptoms, and they have also given you the diagnosis that 11 of this resident grows this Salmonella enterica subspecies typhi, that is Salmonella typhi, and that cause typhoid fever. So they have presentation of the typhoid fever you have given in the question. Now they are asking what? The primary reservoir of this organism. They are not asking about the culture, they are not asking about the properties, they are not asking about the other feature of your disease. They are asking the primary reservoir. So what is the reservoir of the organism? And if you remember the Salmonella species, so Salmonella we have, you normally, if you remember, the typhoid name came from the which organism? This was actually came from the typhoid mari, which is a human. So you should remember Salmonella typhi, the reservoir is human, and other species are reservoir are animal. So let's see this Salmonella typhi. Salmonella typhi is except typhi, Salmonella typhi and Salmonella species except typhi and Shigella. We are not talking about Shigella. We are talking about the Salmonella typhi and Salmonella other species and their reservoir. If you come to the reservoir, then we can find this was the feature, then substrate, carrier stress gallbladder. This was not there. Immune response, excretion, immunoreduce, virulence factor, stress production, reservoir. So the first point, reservoir, Salmonella typhi. The diagnosis Salmonella typhi, human only. So human is the answer of your question. For Salmonella species other than typhi is human and animal both. So here they are talking especially of this Salmonella. So it is only the human, and the answer should be human. So what are the options you have? You have hen eggs, you have dog and cat, you have turkey, you have people in water. So human is people. So people are your answer. Answer D is your answer. You should understand that in that way. Like hen's egg, dogs and cat, turkey, water. This can be your, they are similar. These all are the closely related answer, but they have asked you a specific answer, and the 100% specific answer is primary reservoir. This organism is people, normal people. Okay, now we will talk about this question in the next lecture. Thank you.